Good morning. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I want to talk a little bit more about these bonded blocks that we use in so many uses. I'm just going to show a little part of two or three cases here and show you how we use them in each of these cases. This is just some of the uses that you uh, use these blocks for. And you can put the anterior teeth on, and you can keep the bite from deepening, and you can keep it from opening up, and you can do a lot of things with it. And you can jump cross bites, and you can have a space on one side look like a half inch, and the other side will close up. So let me show you some things so that you won't be you know you'll feel free to use these, and I hope that people will start doing more of this adult orthodontics, and there's a lot of uses for these blocks. So here, this is not an adult now. This is just a young man, but he has a terrible crossbite, and it's a kind of a double crossbite, and he's had his upper 6-year molars out, so we took his lower ones out to balance this up. He had good wisdom teeth and everything, and we got nearly through with the case, and he just disappeared, and I never know what happened to him, but we did get the bite closed down again. Now it's a kind of a double cross bite. This was a lower lateral. We couldn't make the model and keep it on there, and this is the upper, and then behind that is one, and then behind that's another one. It was a dickens of a crossbite to take care of. You can see up above this one lateral right straight behind the central, and the lower laterals out in front of the upper central, and it was just a mess. So we had to open that bite. And so we did. On the right side of the mouth, now the teeth are actually touching in here, you see. And so we bonded this block on the left side of the mouth. Now we took out the teeth first, which was probably a mistake. We should have left them alone and extracted them after we got the crossbite made. So you can see this lateral right here is in front of this central. This central is in front of this lateral. This central, lateral back here. It's kind of a double cross bite. And so we had to open this bite quite a bit to be able to jump these teeth out and change the positions, an open space for the teeth to come through, of course. And so we bonded a block on this side of the mouth that just looking at it looked like it's not a half inch, but it's a lot of distance in there. So we opened the space, and we're bringing this tooth through, and getting this one lined up down here, and getting all this done. And then you look on the right side of the mouth now, and the teeth are already together. Now, when we first bonded this, there was a gap over here about that wide, and I thought, well, it may close or something. We went as fast as we could and opened this space and brought these teeth across. But before I did, these teeth were contacted on the other side of the mouth, and that. This was one of my first times to see that much movement. Now, the teeth didn't erupt out of the bone structure. The whole bony structure with the teeth moved together there. And if you doubt that, just go ahead and try this on somebody. It's not going to mess anything up. Now, when you get the crossbite corrected, you see these teeth were touching on the right side of the mouth. Now we get the crossbite corrected, and we take this block out, And when we first took it out, he had a gap over here about that wide, and these teeth were touching. And in just a short time, these teeth were back together, and the occlusal plane is just as level as it could be. Now, that you doubt that, I'm sure. There are a lot of people that do, but just try that, and it will work. I mean, the occlusal plane will just level out like that. And here it is when it started, and here's the other. No, let's see. We're going into another case now. Let me take that off. I'm showing you things on 2 or 3 cases here. All right, here's another case that's got a terrific deep bite. I mean, he's way down there. And we want to elevate these teeth and depress these teeth down here and level this thing out. All right, so we didn't want the vertical dimension of the face to increase over here, so we put blocks back in this area of the mouth, and we use these intruding wires hooked off of these blocks, and we push these teeth down and these teeth up, and it takes a lot more energy to push them up and down like that, to push them in the bone, than it does for them to come out. And there's almost no change in these teeth back here where we had the block on them, because there's a lot of occlusal pressure back here. And if you don't think there's a lot of occlusal pressure, just put you a couple of those blocks on your mouth, and I tell you bite on them like mad, and these teeth will not come down at all, which would cause an opening of the vertical dimension of the face. They stay right where they are, or else you can lower actually the vertical dimension sometimes by putting these blocks in somebody's mouth. Now, that sounds crazy, but it is true. And if you get in there, and we need more people doing these fairly complicated orthodontic cases that goes on. Now this was, let me go back here, this was class 2 on this side, and it's class 1 on the others on the left side, and it's class 2 on the right side, and these teeth absolutely covered the other teeth up right here on the lower, covered the lower teeth up. And here's a young man after we got through. Well, this is the blocks that we had on here. And you see we had to open this up. Now you put this thick a block in here, and you're going to have a lot of pressure in here. So the occlusion keeps these teeth from moving, while these teeth go up and these teeth go down. Now there's always exactly the same pressure pushing these in the bone as pushing these out of the bone, but the occlusion fills in back here, and these teeth go up and these teeth go down, and you don't raise the vertical dimension of the face at all. So try that. I don't want to be teaching anybody anything that won't work, or hope it doesn't. But there's so much of this complicated kind of orthodontics that people just, they're looking for kids, that are just really easy. So you have to put a little thinking of what you're going to do in here. All right, when we settle this is how big those blocks were back there in the back. And I'll tell you, you press on them. Now, they're not bonded up here. They're bonded on down on the bottom, you see. And you can trim them and do things with them, but they keep the teeth apart back there, and you bite on them. And now, as we take these off, when we take them off, these, you hold them where they are, and then you put retention in there with a bite plate, so this won't go back again. And so if a person loses their retainer, though, with a bite plate, they tend to deepen again. They put them back in after a week or two, and they just hit in the front. And then if they just hit up here, your back teeth don't hit, and then you hit your condyles, and it gives trouble. And they think it's the retainer that's screwed up, but it's not. It's the bite has deepened again. It'll try to deepen for years after you finish doing something like this, even though you didn't open the bite. Now this is the right side's class 1, and the left side is class 1 too. And this is the guy. All right, we'll show you one more case here. This is a young lady. She's got some Oriental genes in her, and she's got a fused tooth down here on the bottom, and over on this side the laterals are fused to the cuspids, and so it made it much more narrow over here. So we extracted a bicuspid on each side to compensate for the teeth that were missing, or more or less missing, on the lower down there. We took the ones out on the top, and we had a terrific crossbite right here. This lateral is right back behind this cuspid and down in here. So we had to open this up and spread this out to bring that through, and we took this out. We moved this back to do that. This worked out really quite well. Now here we go. We're way into the treatment, and we had this side is already closed up over here. We opened the left side of it to do that, kind of like we did on that first case. And let's see. Now you can see how big a block we had to put in here so we could jump these crossbites right up in this part of the mouth. Now when that was in there, and before we got the crossbite out, the teeth on the other side of the mouth, you can see how it goes down like this, comes up. This gap is big over here, and these teeth are together. And I'm telling you, this works. These teeth just move down the whole bone structure. The teeth don't move out of the bone or anything. You can check them, and these move up while you're doing that. Now you take this off, and these teeth will move back some, and these teeth will come back together, and your occlusal plane will be just level across the front. So here we're going to take this block out, and there it is from the top side. Just a little bonded acrylic on there. You use Triad or whatever, light cured acrylic if you want to. And here it is. The occlusal plane is leveled out, and the crossbite is corrected, and it stays level. And we do that with these blocks. And that's, I think, the end of this deal, showing you what how you use these blocks. When you got a open bite skeletally and dental, and you're trying to, whether you have a closed bite dental and a open bite skeletally, you've got to open the teeth up in here. If you don't use something back in here, you'll increase the vertical dimension of the face. And that's why they tell first people just getting into orthodontics, stay away from these high angle cases in there. So anyway, I hope you pick up something from this, and we want to get people all over the country and the world doing real good orthodontics, and that's what my objective is. And I hope you learn it and teach it to somebody else around you, so we'll get people doing the best orthodontics we can possibly do. Thanks for watching. I hope you join our group and subscribe to it, and we really appreciate having you. So thank you now, and I'm going to close up, and we'll talk with you later. Thank you.